Welcome to the AM News, right here on the AM Show. Details now, starting with the Trade Union Congress has issued a stern warning to the Social Security and National Insurance Trust to halt the reported sale of 60% of its stake in 4 hotels to MP and Minister for Agriculture Brian Champon's Rock City Hotel. SSNIT, in a statement, denied any foul play in its decision to sell a 60% stake in its hotels to Rock City Hotel. The trust fund said the Rock City's hotel submitted the best and strongest financial proposal out of 6 shortlisted entities. Now, organized labor insists the decision by SSNIT to offload its shares to Rock City Hotel is unjust and an act of state capture. My colleague Michael Ashali was there and has come through.
SSNIT said in 2018 they started the process to sell 60% of their interest in 6 hotels: Labadi Beach Hotel, La Palm Royal Beach Resort, Ridge Royal Hotel, Elmina Beach Resort, Buzia Beach Resort, and Trust Lodge. By December 2019, they said they had selected a transaction advisor. They later advertised for an expression of interest for a strategic partner. A total of 9 companies responded. They settled with Rock City Hotel. Organized labor is asking government to, as a matter of urgency, cancel SSNIT's move to sell its interest in some hotels. Dr. Yaoban, who represents the TUC, says there's a lot wrong with this particular deal.
We in organized labor find it extremely difficult to understand why. First, SSNIT's interest in 6 hotels will be packaged and sold as if all the hotels are in the same financial situation. 2, we find it difficult to understand why the original proposer of the sale of SSNIT's interest in 6 hotels has now reduced to 4. We hold the view that this renders the whole process null and void. And 3, we find it difficult to understand why the proposed payment terms varied from the original MOU based on the recommendations of the transaction advisor. We cannot imagine that state properties will be sold to a minister of state. For us, it smacks of state capture, and that should be stopped, and stopped immediately. And if the Minister for Pensions, who is also Minister for Employment and Labor Relations, failed to stop SSNIT, we workers of Ghana, we own the funds. We will stop that process.
Additionally, the TUC is seeking an audience with President Akufo-Addo to discuss more urgent issues.
We ask the President to convene a meeting with leaders of organized labor to discuss SSNIT, and this is one of it. And our reps on the board of SSNIT had intimated that things were going on that require the meeting between President and the leadership. And we didn't want to bring this up in public. We still insist that the President should make time for us to discuss this and many other issues about SSNIT that our reps had brought to our attention. May 6th, today is May 20th. We expect that the President will invite us as soon as possible because there are many other issues.
According to
Now, stakeholders are promising to do more in the area of suicide prevention, especially child suicide, as they have, for the first time, developed a scorecard tool for media reporting on suicide. A stakeholder consultative meeting also adopted the latest World Health Organization recommendations for media reporting on suicide. Now, according to the WHO, there is a direct correlation between media reports about people who die by suicide and subsequent additional suicidal acts. This, they hope, will go a long way toward positively impacting preventive suicide.
According to the World Health Organization, at least 700,000 people die annually due to suicide. Suicide is the leading cause of death among 15 to 29 years olds globally, with 77% of suicide-related deaths occurring in low and middle-income countries, including Ghana. Responsible reporting on suicide, where information on support services is provided, can effectively drive down suicide figures. It is in this regard that the Association of Suicide Prevention Ghana, GASP, organized the consultative stakeholder meeting with over 13 stakeholder organizations to adopt the latest WHO guidelines on suicide reporting for the media and also develop a scorecard tool for media personnel reporting on suicide. Made up of academicians, mental health professionals, crisis workers, pastoral care workers, media personnel, volunteers and suicide survivors, GASP is established to prevent suicide and suicidal behavior and alleviate its effects. Dr. Niboy Kwashi is the president of GASP.
We have seen certain individuals who are within the media landscape for a long time who have been working around suicide prevention, providing public education and so on. And a fine example is yourself, Ohemi Teria, with Joy News. And going forward, the plan is that having agreed on some guidelines, we will organize trainings for our media professionals, and we will try to share with them these resources. The third leg of it will be that at the Association for Suicide Prevention, the scorecard or the basis for evaluation, that resource will be used by our center or the association to monitor periodically, get onto the platforms, pick up newspapers, go onto the online pages of all of these media houses in Ghana and see how they are making use of these resources towards improving the appropriateness and quality of news about suicide.
Meanwhile, some stakeholders who are already excited about the measures being undertaken are promising to do more in the area of prevention to save lives. First is the chairman of the National Media Commission, Yabuadu Ayabuafo, who thinks suicide reporting is newsworthy and must be done with all circumspection.
When somebody commits suicide, there's a possibility that he will leave behind children, and somebody will have to take care of those children. So it becomes an issue for the public.
We have had the stakeholder engagement with the Association of Suicide Prevention of Ghana. I think it's very timely, very good. They have opened our eyes to what can be said, what cannot be reported on.
What we're going to be doing specifically is to ensure that we do health reporting that takes account of suicide reporting as a health issue as part of the undergraduate curriculum and also at the master's level.
Participating institutions include the National Media Commission, the University of Media, Arts and Communication, the University of Ghana School of Public Health, the Ghana Mental Health Authority, the Ghana Journalists Association and GIBA. Others are the Ghana Psychological Association, the Ghana Health Service, as well as representatives of religious groupings. From Peduase for Joy News, Ohemi Teria reporting.
In other stories, Vice President Dr. Mahmoud Bawumia has stated that the Upper West Region Integrated Recycling Composite Plant and Medical Waste Plant will not only manage 400,000 tons of waste, but will create over 1,000 direct and indirect jobs in the enclave as well. Speaking at its commissioning in Skperi in Wa, Dr. Bawumia says it will improve the healthy conditions of the people and reduction in air, water and land pollution. Joy News' Upper West Regional Correspondent Rafiq Salam reports from Skperi.
President Akufo-Addo on October 9, 2020, broke the ground for work to begin on the integrated recycling composite plant and medical waste plant at Skperi in the Wa municipality. The aim of the project is to receive and sort solid waste in the Wa municipality and the other 10 adjoining municipalities and districts in the region. The waste will be processed using the state-of-the-art processing machine to convert the organic component into compost. Other recyclable materials such as plastics, metal scraps will be extracted from the waste and reused as raw materials in the plastic and metal industries. After almost 4 years, work on the 400,000 ton daily capacity municipal waste plant was completed. Engineer Malik Kobla Daniel is the plant manager of the integrated recycling composite plant.
Now we want to decentralize this whole intervention and bring them to all the regions. So what happens to the plants now? This plant will serve the good people of Wa and its immediate environment.
The medical waste plant, on the other hand, will also manage hazardous waste from health facilities in the region. According to the general manager of Medical Waste Limited, Engineer Sinem Tenge, the plant will be able to treat 5,000 tons of infectious medical waste.
So this implies that we have various trucks, specialized trucks that move from one healthcare facility to the other to pick up the segregated infectious waste and transport it to the treatment center here. Over here we have microwave treatment systems that sterilizes the harmful organisms in the waste, making it harmless for final disposal. This implies that if you have any form of infected syringe, if you have blood-stained material, any material that is hazardous in any way, this equipment is able to render it totally harmless.
At a colorful ceremony attended by people from all walks of life, including prominent paramount chiefs from the region, government functionaries, Vice President Dr. Alhaji Mahmoud Bawumia, in a brief statement before he commissioned the plants, noted that the project is an example of the collaboration and partnership between government and the private sector. Dr. Bawumia disclosed that the commissioning of the integrated recycling composite plant and medical waste plant is the 7th in the country and has the capacity of processing not only 400,000 municipal solid waste per day, but also employs
of the facility includes over 1,000 direct and indirect jobs, healthy environment, improved health conditions of inhabitants, improved living conditions of the populace, and reduction in air, water, and land pollution. The Wa Medical Waste Treatment Facility is one of the 14 centralized medical waste treatment facilities being established by the Jospon Group of companies in collaboration with the government of Ghana. This is the 4th facility to be commissioned after Kumasi, Ho, and Takoradi plants were inaugurated in 2023.
Apologies for that sound. We'll bring you a revised one in our subsequent bulletins. But away from that, thousands of natives of the Achim Ebuakwa state, friends and well-wishers of the Ochinhene Osajefo Amwetia Ofori, are expected to visit the Achim Ebuakwa traditional area between May 2024 to December 2024 as the Ochinhene celebrates his 25th anniversary of the accession to the Ofori Painting Stool. Now, the Ochinhene's Silver Jubilee celebration is under the theme 25 years of sustainable leadership and service to humanity. Maxwell Kudeko has more in this report.
Addressing the media at a press launch of the 25th anniversary celebration in Chebi, the Ochimantwa Frihen Oketeche Boache Dankwa espoused the achievement of Osajefo Amotia Ofori Painting and described him as a paragon of innovative traditional leadership with few rivals.
Osajefo took over at the time when Ochiman and the eastern region were confronted with many developmental challenges. Ochiman wore the unenviable tag as the poorest performance in the basic education certificate examination, BEC, despite significant public investment. This had its roots in growing social crisis of typical truancy, increase in the school dropout rate, the surge of teenage pregnancy, and the spread of HIV. Nananom, led by the Osajefo, had to step in often in the necessary deviation from outmoded cultural limitations to address the HIV menace and teenage pregnancy as a first step. Osagyefo launched a successful advocacy for increased funding and rekindled the interest and involvement of parents in their children's education. Today, the impressive strides we have made in terms of rapid reduction in the school dropout rate, reduction in the incidence of all teenage pregnancy matters, and decrease in reported cases of HIV infections is a tribute to Osagyefo's exemplary leadership and advocacy. This, we cannot be said only for the basic education, but also secondary and higher education over the last 2.5 decades. Under his leadership, 10 basic education schools, christened the Amoitio Ofori-Penny Model Schools, have been established in 10 locations within Ochimai to actually complement the efforts of government in the education sector. Ochimai is noted worldwide for its flora and unique fauna. The establishment of the UCAES is the relative result of the personal fidelity of the Osagyefo in the Forest Ochimai agenda. In particular, the world-acclaimed Itiwa Forest, which is not only a home to diverse and rare species of mammals, birds, and butterflies, but more importantly, it serves as the ecological backbone for several water bodies in the eastern and Accra Plains. Forest provides for game, ecotourism, traditional medicine, and sustainable commercial agriculture. It is by this conviction that on several occasions the Osagyefo has initiated fruitful deliberations with the then Prince Charles, now King Charles II, Rainforest Project, and other renowned conservationist institutions across the world about the measures to stem the tide of climate change and global warming.
Up next, business update.
Time now for the business update on the AM show. In our first story, the Institute of Economic Affairs says the Ghana cedi is under serious threat following the significant depreciation of the currency by 13.7% up in mid-May 2024. Now, the IEA further proposed an alternative to full dollarization, which would be to adopt a currency board system and for the Bank of Ghana to progressively build up its foreign exchange reserves to at least 70% of the currency in circulation.
In a recent press release, the Institute of Economic Affairs have highlighted the critical state of the Ghanaian cedi, emphasizing the need for immediate and sustained interventions to halt its persistent depreciation. The cedi has depreciated by 30.0% in 2022, 27.8% in 2023, and 13.7% up to mid-May 2024, with an overall depreciation of 99.99% since adopting a flexible exchange rate in 1983. The cedi's current value is 13 Ghana cedis, 77 pesos to $1, which, according to the Institute of Economic Affairs, signifies an existential threat to the national currency. The IEA is proposing that the government should engage with both the IMF and the external creditors to reach an early agreement on the external debt restructuring exercise. The second option is for the Bank of Ghana to step up for the enforcement of FX market regulations, which includes limits on FX carry-on for travelers and supportive documentation for FX purchases. The Institute further encourages the Bank of Ghana to work with security agencies to monitor acts of illegal FX transfers through banks, forex bureaus, and other channels. The Institute is urging the government and stakeholders to take decisive action to secure the future of the Ghanaian currency and, by extension, the economy.
In our next business story, the Chief Executive Officer of the Ghana National Gas Company, Dr. Ben Asante, is making a case for more gas pipelines in the West African sub-region to improve the distribution of the commodity at affordable rates for countries that need it the most. According to him, The lack of infrastructure on the continent and the region is contributing to the high cost of gas to supply power plants across the region. Dr. Asante made the call at the ongoing Society of Petroleum Engineers Biennial Summit and Exhibition in Accra under the theme, Embracing Innovation, Redefining the Future of the Oil and Gas Industry in Africa.
The second biennial summit and exhibition of the Society of Petroleum Engineers is part of the initiatives to create a common platform to discuss matters of concern for the industry. Chief Executive for Ghana Gas, Dr. Ben Asante, in a keynote speech advocated adequate investment in infrastructure, including pipelines, to be able to transport gas to member countries at an affordable rate.
Having all those who are net exporters of gas, for example, to have the requisite infrastructure to connect to those who are net importers. So, we're talking to people in Equatorial Guinea, in Nigeria, and whatnot. So the idea of having that Morocco pipeline is great. Secondly, the West African gas pipeline, which has been in operation for well over 10, 15 years, is also a laudable idea to bring gas over to WN, certainly to Ghana as the anchor point. But we need more intra-continent to link those who are net exporters of this valuable commodity to those who are net importers.
Section Director for SPE Ghana and Coordinator for the Association of Oil Marketing Companies Ghana, Dr. Rivers Nopon, explained that technology can be deployed to deal with the infrastructure gap in the sector.
In the moment on when discussing the energy transition issues, we actually discovered three challenges that Africa faced, and the first one was geopolitics. Second one was funding, and then the main one was technology. We realized that we could not transform because we lacked technology, and the reason why we chose this topic is to start a discussion around energy transformation, digitalization, and innovation.
The regional director for SPE Africa, Egoho Efiam, stressed the need for more collaboration between government and private sector for Africa to maximize benefits from the oil and gas industry.
It's been very receptive. The governments have been very receptive. You've seen GNPC is there. You see Ghana Gas is there. We have folks even from the Nigeria Council that are here as well. Senior people from other countries that are also here as well. So I believe that SPE has been given quite a welcoming, a very big welcome, both in Ghana and elsewhere in Africa. It's impressive, I assure you.
Thanks for staying for the business news. Back to you, Sweetie Abochi.
Right, on that note, we end the AM News. On to the conversations now, starting with the newspaper review segment. You want to stay with us.